In today's video, I'm going to quickly tell you about our plan for the next 12 months. We currently have two open playlists, the ICU Crash Course playlist and the Essential Clinical Skills playlist. Two new courses playlists will be added, EKG and Rhythm Strips course and the 50 Most Common Nurses Phone Calls course. In the ICU Crash Course, we still have a lot of topics to be covered. We will be covering all different kind of emergencies and how to respond to them. We'll resume talking about the commonly used drugs in ICU, including sedatives, paralytics, antiarrhythmics, and analgesia. We'll also cover nutrition in critically ill patients. Also, we'll touch on how to tackle urine output issues in ICU and many other topics. In the Essential Clinical Skills playlist, in which we already talked about how to run a smooth code blue, we will cover how to do hospital admissions, how to efficiently round on your patients, how and when to discharge your patients, and many other skills. In the new EKG course, we'll teach you how to identify and act on the clinically significant EKG changes in a very practical case-based way. And finally, in the 50 Most Common Nurses Phone Call course, we'll teach you how to respond to the most commonly encountered clinical problems that nurses usually uncommonly call us for. We'll teach you how to respond to the phone calls and how to act on each problem. We will continue to release a video every other Sunday at 12 p.m. US Eastern Time throughout the year and stick to the schedule as much as we can. We will cover all the playlists simultaneously. So next video will be from the clinical skills course, then the video after will be from the EKG course, then the video after from the 50 most common nurses phone calls course, and then the video after from the ICU crash course, and keep repeating these cycles until hopefully we finish all these topics. Now, of course, to stay up to date with our videos, simply subscribe to our channel and tap that notification bell so you get notified every time we release a video on the channel. Thanks for watching and I'll see you next video.